Welcome back. Thank you for joining us here on Open BXRX Tuesday. This week, the Whole Health Report, sponsored by Empire Blue Cross Blue Shield, is back. Today, we are welcoming back Laura Brosen, a registered nurse, and we're joined by Melissa Pino, a food bank for New York City, to discuss food insecurity. Thank you both for joining me.
Thanks
Thanks
for
so
having
much,
us.
Evan.
So, we're going to jump right into it. Can you just explain what is food insecurity and how is it affecting residents of the Bronx?
Sure. So, food insecurity is the lack of sufficient and nutritious food enough to feed the entire household. And that can happen for a variety of reasons. It could be unemployment, underemployment, or the lack of access to food because of the community of where the people are living and the resources in the area, or because of what happened during COVID, so that programs weren't available, or because of people receiving things through resources that weren't open. So, community programs that weren't able to operate, or schools where children were receiving school lunch programs weren't operating. And during, even before the pandemic, the numbers that you showed, we were seeing that children, about 85,000 children, were going hungry, but that climbed after in 2020 up to about 125,000. So it's only getting worse. The pandemic just amplified what we were seeing.
And can you just reiterate how it's affecting residents of the Bronx?
Sure. So, in the Bronx, which the Bronx, as we know, is one of the most unhealthy counties in New York City, where there's chronic conditions, diabetes and heart disease and other things, where in an urban area and there's not as much access to fresh produce and um, healthy food, it just is, you know, exacerbated even more.
Thank you so much for that. Now, Melissa, can you tell us a little bit about the food bank, how it works, and what is it doing to get Bronxites and nutritious food that they need?
Sure. So, Food Bank for New York City receives monetary donations, but also work with local and federal governments to fund operations and food distributions. I've been with Food Bank for New York City for 12 years now, and I've specifically worked with members in the Bronx. I now currently serve as the senior manager of Mobile Pantry, and our Mobile Pantry program is a consistent and dependable monthly distribution, bringing shelf stable products, fresh seasonal produce, and frozen protein to high need areas throughout New York City.
Laura, what are the implications of food insecurity from a health perspective?
So I'm so glad that you asked that. We talk a lot about whole health, and when you consider the members' whole health, you think about their mental health, how stress can be impacted, for chronic conditions such as high blood pressure and diabetes. Food is medicine. Food really is medicine. So if you have diabetes and you don't have access to fresh produce and lean proteins and things that can keep your glucose under control, you're really reaching for things that are low cost and shelf stable, as Melissa just spoke to. Some things like, pasta and canned goods, which can be high in salt and high in carbohydrate, then you're going to make your chronic conditions worse and you're going to become less healthy. So when you think about, not having enough to eat and the stress that that can cause, so mental health, the whole health of the person, asthma exacerbation, and in the Bronx, put all that together, and that's the implications of food insecurity on a family.
Wow, that's a lot. So thank you so much for sharing that. Melissa, I'm sure COVID must have impacted the food bank. Can you tell us a bit about that and what were some issues or obstacles your organization was facing during that time?
Sure. So before COVID-19, nearly 236,000 Bronx residents, or 16.5% of the population, were already food insecure. So the number of our neighbors in the Bronx who are food insecure is now close to 36% due to the COVID-19 pandemic. And some of the obstacles that we have been facing, as we hear it in the news all the time, the supply chain challenges, we're also being affected by that as well. We've had to modify our orders, we've had to modify our vendors to ensure we have access to the products that we need.
And how, I'm sorry. No, you can go. You can continue.
Sorry. Additionally, the cost of food is rising. So families that purchase food need to stay healthy. A recent example that we heard from a client, and actually from Parkside in the Bronx, shared the same bag of couscous that we were providing cost him $10 in his grocery store. So just the cost of everything is increasing.
I really love that you mentioned that because I think that is something that many people have noticed, and it's only made food insecurity even more of a challenge for people who are already struggling to afford healthy food. The fact that it costs more, I can only imagine how much more challenging that is. So, thank you so much for sharing that. I really like to know, how has COVID impacted the way you and your agency distribute food?
Yeah, so some of our partners have increased their days and hours. Some members have even allotted a specific distribution time for seniors, since we know our seniors are more susceptible to COVID. So many member agencies have sprang into action and are committed to expand their days and hours to provide those services that our clients are looking for.
Now, I'd like to hear it from both of you. Can you just explain what resources are out there for our viewers?
Sure. I'll jump in first. I know that Melissa's going to have so many great resources to share as well. I think that New York City does a great job of providing some resources. So if you go to nyc.gov, 311, you can call 311, or on nyc.gov, you can look at the resources there. There's also, talk to your doctor if you're having difficulty. They might know about programs in your area. They're a great resource. Go to your community centers, maybe through your church or your faith-based center if you're part of one, and you might find some resources. If you have health insurance, talk to your health insurer. Call the number on the back of the card. Go to the website. There's programs available. I know that at Empire Blue Cross and Blue Shield that we have programs. Visit our website. And those are some of the things that we have available. Melissa, I'll let you speak to the things at the food pantry. I know at the food bank, I know you have things too.
Sure, thank you. So Food Bank for New York City offers additional services, and we actually have our member networks that also participate in providing additional services, such as food stamps, taxes. We are in tax season. We have a program for free taxes for anyone living in New York City, and that just is, to help reduce the cost. Getting your taxes done for free ensures that you're able to put more money towards purchasing food or paying bills. And you can find all of our programmings on our food bank website, foodbanknewyorkcity.org.
All right. Thank you both so much for joining me. We'll be right back with more Open BXRX Tuesday.